In this segment, we're going to demonstrate a counterstrain technique for an upper thoracic midline tender point. And classically, Jones described this in the prone position, but some people find that position very uncomfortable. So this is a supine variation to treat a posterior upper thoracic tender point. And in this case, we're going to say the patient has a posterior thoracic midline T2 tender point. We'll sleep. Now I find the C7 spinous process, come inferior, find T1, find T2, go inferior to the tip of T2. I'm curling my finger and I'm going to probe along the midline from inferior to superior to elicit the pain. So I'm probing or pressing, and the patient says it's a 10, or we're going to tell the patient to remember that it's a 10. Now we're going to ask the patient to bend their hips and knees and slowly try to bring their whole body up toward the edge of the table so that, there we go, and then fall asleep. And now to control her head and neck so you don't hyperextend the occipital-atlantal articulation, and we're going to take her into extension, and I'm going to push straight up so it's almost like it's folding T2 around my finger. So that midline point requires pure extension, and I reprobe to hopefully get that point to completely alleviate. Once we reach the maximal position of comfort, we're going to hold this position for 90 seconds, and then after 90 seconds, of course, we will reposition the patient back passively to a neutral position and then re-probe to re-quantify, and hopefully the patient says the pain has been completely alleviated, or at least 70%. Now, there also may be a tender point just inferior lateral to that spinous process. And again, so T2, posterior tender point on the inferior lateral tip of the spinous process, again, would require primarily extension, but also maybe requiring a little bit of fine-tuning in side bending and rotation away. We really have to, there we go, extend, but try not to hyperextend the OA articulation. Find the position of maximal comfort, hopefully 0. Some clinicians would actually say trying to turn off or shut down the tender point. Once we find that position of maximal comfort, we hold for 90. After 90, we reposition to neutral and then reassess. And hopefully we've achieved at least 70% reduction of the pain. So that's a supine variation treating a posterior thoracic tender point, in this case a posterior thoracic T2 midline and a posterior thoracic T2 off the inferior lateral tip of the spinous process of T2.